Morning, and thank you all for being here. Can you hear me fine? Okay, great. Um, the Southern Medical Journal welcomes your participation, at least your consideration of participation. The journal has been active for well over 100 years, actually over 110 years, and continues to serve not only people in clinicians in the region of the U.S., but it is now an international journal. We have an international editorial board and receive manuscripts really from majority of the first world countries, and we have really enjoyed learning from our colleagues in other parts of the world. So have no conflicts of interest except that we are on the editorial staff of the journal. I guess that is obvious itself. So I'm going to give some preliminary things for your consideration, and then ask Jennifer Price to talk in her role as managing editor, and then Dr. Steve Baldwin, the incoming editor-in-chief, will get up and hopefully let you have some ideas about where he might see things going in the future. This is the set of learning objectives. Really want you to better understand how manuscripts are handled when they come through the journal to us, how decisions are made. But preparatory to that, what are the things you need to know in developing the manuscript from the time you think of a hypothesis to the time the manuscript is submitted itself. And remember that we receive large numbers of manuscripts, as do all journals each year. And so we have to have some considerations about how a particular topic would fit in with the mission or theme of our particular journal. This is the third journal of which I have been editor, and will be my last editorship, and I have tremendously enjoyed it. Primarily because we have developed this journal into a interprofessional, multidisciplinary type of a journal. So I learned a great deal, just as I have from seeing some of your posters this morning. The editorial boards, both domestic and international, have a membership of really outstanding individuals. Not only those who have long served as reviewers and authors, but also whose reputations and particular strengths that they can bring to Southern Medical Journal have been identified. Many of the international editorial board members have been participants in the Auburn Physicians Executive MBA program, particularly through the course, the capstone course that looks at international healthcare systems, and we have had great success there. In fact, that's how Ms. Price and I met Dr. Baldwin. He was a student in the MBA program, and we got to know him and realize what his capabilities and accomplishments were. Over the last 9 years, we have changed the journal from essentially a general medicine, read primary care type of a journal to one that is more multidisciplinary and reaches, we hope, a wider range of clinicians in the profession of medicine. We have these 8 different topic headings and invite manuscripts in all of them. Probably one of the greatest areas of expansion that we have had is actually in the medical education area. We're receiving increasing numbers of manuscripts on aspects of medical education, not only medical students, but resident education, and we really enjoy seeing all those manuscripts. So if you're considering submitting something to the journal, it's very likely that your topic would fall into one of those 8 because they pretty much cover the field of healthcare. Now, the success of a publication, that is from the time that you have submitted it to the time it is hopefully accepted, is fairly well described. We have lots of individuals who submit original research, which is great. We have some perspectives. We have some review articles. And then the occasional letter to the editor, which we always try to respond to. And so the success comes in making sure that the manuscript up front has the elements that we realize are important for a high level of scientific description. Has to comply with the AMA Manual of Style, have proper scientific grammar, appropriate reporting according to introduction, methods and materials, results, discussions, conclusions. Some journals will have a little bit different requirements in those areas, particularly in the abstracts. But if you look at the information for authors, you'll see what that particular journal requires. We also prescribe a certain amount of pages, word numbers, word count, and have some limitations to the number of references and figures. We can add some in a form that's online that can be additive to even some multimedia sorts of things. But primarily, we try to give the directions to you as potential authors about what we expect and do require. So in many cases, particularly those that come from residents and those from individuals whose first language is not necessarily English, we do recommend that you have some outside person at your institution look at the manuscript and review it before you send it in. Scientific writing is a bit stilted, and any time that you are writing in a more relaxed language, it doesn't always come across as scientific. For instance, just recently, I've heard my residents, and I still see patients and operate, I heard my residents talking about this patient endorsed shortness of breath or something like that. So I said, what do you mean about, what is this endorsement? You know, the sports figures endorse, but how does a patient endorse? And so I think it's kind of a slang part of everyday grammar when they really mean the patient complained of. So endorsement has not yet hit the big time in scientific literature. So if you're writing up something, it's probably best to have some other eyes to make sure that the quality of the grammar used is indeed scientific and acceptable. So our submission is, like most journals now, online and through an electronic service system that is connected with LWW publishers. Several years ago, Mrs. Price brought the journal in-house to the Southern Medical Association, which is the supporting organization for the journal. We have an upfront review. Typically, it is Mrs. Price, who has a master's degree in English, and me, and we look at it to see if it complies in good part with all of our instructions, to see if it's a topic that is germane to clinical medicine as we try to present in a multidisciplinary area. We really don't do laboratory medicine topics unless they are associated with the clinical scenarios. We don't do single case reports because the educational value to a given clinician is low, but we do a multidisciplinary case report, which is looking at the patient and having the evaluations from multiple services and how a team effort took care of a patient. That's in our instructions for authors. If it looks like it's potentially a good fit and the grammar and scientific content is good, then we'll select reviewers for that particular manuscript and send it off to them. They have a certain amount of time to get it done and then send it back, and we look at their comments and their suggestions for what needs to be done. Almost every manuscript is invited for revisions. Very few manuscripts are accepted as is. That's because most of them can be improved in some particular way or something that the author maybe did not think about at the time. So revisions are quite common. They can range from major revisions to minor revisions. We send it back, they respond, we send the responses to the reviewers. So we work through that process over a couple of months period of time until a decision can be made about the particular article. Once it's accepted, there's a group associated with the publisher that does some of the making the proofs. They send it to you with questions, and then it's published in the next available issue. I'm sure all of you at some point in time, whether it was undergraduate or medical school or even residency, have been exposed to the principles of planning and conducting a scientific research study. And so this is just a flow chart and a little bit about the normal way studies are conducted. In our residency, we start our first-year residents learning about the potential for different research projects, and then they begin to set it out with the faculty mentor. They have to present everything to the IRB, which takes a lot of time. Then once approved, they start the study, accrue patients or whatever, and then they have about 4 years over that course for a really good study before a manuscript is actually ready to be submitted somewhere. That's not necessarily the case for all, but for a very comprehensive study, such as an outcome study, that's a very good type for a resident. So we like to see them set up according to the scientific method. Drafting the manuscript is very important, and it's sort of like running a race. You have to take that first step, and oftentimes that's the hardest, just getting everything together, all of the information, and then beginning to draft the manuscript. But it's a very important part because you have input from a whole group of individuals, hopefully within your department, who can be of assistance to you. When I talk here about multiple revisions, I mean revisions to the draft manuscript in your institution, not when after it's submitted, because you have to go through a number of rewrites on your manuscript before you even have the go-ahead from your mentor to submit it. And that oftentimes will be very painful and take a long time, but it's well worth all the time that you can do so that it's in the best shape possible when it's submitted. Every journal is a little bit different, and so it's so important to have instructions for authors that we present online, and you should always read them. Sometimes we'll get something, for instance, we'll get a case report that's submitted, and the authors did not read our instructions for authors. It said we no longer accept single case reports. So we have to send it back with a little section copied and say, sorry, but you might consider sending this to this journal or that particular journal. The references should be placed according to the AMA Manual of Style. The 2020 version of the AMA Manual of Style comes out in February, I think you can get it online from the AMA, and it's something that you really ought to check. That tells you how to write scientifically, and it's an excellent guide, probably the most important guide that you'll have next to the instructions for authors. You have to have some statement there about conflicts of interest. Not as important when you're writing a manuscript as a resident, but we have individuals who have been associated with pharmaceutical companies or device companies who have a significant conflict of interest. And if it's not noted there, sometimes they'll just say written in conjunction, the study was done in conjunction with such and such drug company. We really investigate that. We do our due diligence, and subsequently we have stopped accepting manuscripts that are associated with certain pharmaceutical companies because of the risk of ghostwriting. That is, the clinician may provide data, but it's all evaluated and tabulated, and everything is written by some ghostwriters paid by the pharmaceutical company. So we really pay a great deal of attention to that, even tracking it down a little bit, Sherlock Holmesism when we need to. When you select a journal, it's important to sort of look at what their mission is. The first journal that I edited was an otolaryngology head and neck surgery journal, and it was pretty obvious what the mission there was. My next journal I edited was Aviation, Space, and Environmental Medicine. It was primarily aerospace medicine, and that had a whole different mission and a whole different set of people who submitted manuscripts to it. And now the Southern Medical Journal is a multidisciplinary one. We accept manuscripts from a wider range of healthcare providers than previously, including individuals in the, who are doctors of pharmacology, public health people, and so forth. So look at the journal's mission and see if it fits with the topic that you have. The AIM-RADC is important for our journal as well. Just a little bit of a warning, I think. Over the last couple of years, there have been just scores of new journals that have popped up from overseas. These journals are essentially pay-to-publish journals. Dr. Baldwin and I were talking a couple of days ago about this issue. We get probably several, 2 or 3 invitations to submit our work each day by email to some of these new types of journals, and the names of them are oftentimes very similar to the well-known traditional journals in medicine, but they're just enough off that you realize something's going on there. And the language of the invitation may be a little stilted, such as we are happy each day to offer this to you, to please submit a paper for us, something that doesn't quite fit. And then you find out that, yeah, they'll accept your paper, but you have to pay $3,000 to have it published. So I ask you to be wary about that and to follow your mentor's advice about keeping them in the traditional healthcare journals that have a long history and good reputation. Oftentimes, this is from us, most publishing companies will offer tutorials for the authors. So it really helps you find out what do I need to insert into the things that I submit electronically. And I would recommend that before you submit to any journal that you look for one of these tutorials for authors, chock full of information that really are very helpful to you. Our reviewers also have a tutorial, and that's very important because Not only can authors have conflicts of interest, but also so can reviewers have conflicts of interest. Just as you have sat in on grand rounds or M&M conference or QA conference and have a topic come up, and one attending will have this aspect of their thought process, and another attending might be counterposed to that. Nothing wrong with it, because you learn from all different points of view. And so there can also be a little bit of conflict between an author and a reviewer. And so we do watch for that, and have our reviewers make sure that they understand what their ethical responsibilities are when they review an article. So when we go through the review process, we have those recommendations over there. Accept is usually down the line after multiple revisions have been made and been acceptable. Minor revisions are usually an indication that, yes, we feel that this manuscript's probably going to hit the bar, and we just have some things we'd like to see improved or clarified within the manuscript. Major revisions, that doesn't necessarily mean we're going to accept it after revisions. We're going to give the author a chance to see if they can make it better, and if they can't, so be it. And then occasionally we do an outright reject for various reasons. Our decisions are based in very good part on a combination of the editorial office review and the reviewer's review, and how well the authors have responded to the reviewers or to our editorial office comments and questions to them. So the authors then consider the recommendations and comments by the reviewers and the editors. And what I think is important there is that they make revisions as they feel appropriate. There might be some things that they typically just don't want to change in the manuscript, and that's fine. We just ask them to explain to us why it is that they don't feel the change needs to be made, or respond to a comment that maybe explains it well enough that we don't need them to revise anything. So after that process goes through, then it comes down to making a decision. Decision is in the hands of the editorial office, and so we have a fairly low rejection rate because we do a lot of upfront analysis of the articles before they're even submitted to a reviewer, and we do reject most of ours up front before we actually ask the reviewers to make any comments on those. We try to be tactful. One thing I would indicate to you, and this is also important when you're looking for a job, and most of you are residents, but some of you are medical students when you're applying for residencies. I've been a program director twice, and I always ask the residency coordinator and the receptionist and the folks, what were these young people like specifically? Was any of them, or were any of them sort of not very polite to you? Were they demanding and so forth? And so the way you treat the individuals on the front end of the process, and it holds true for residency and job applications, can have a bearing on how we view your manuscript. And we occasionally have some authors who are overbearing, who are impolite, and we kind of have zero tolerance for that. If we can change their behavior with a word or two, we can. But otherwise, I would just suggest always be polite, always be nice. So some issues to avoid. There's a reason why the top bullet is in caps. It's a very, very important thing. I think Mrs. Price will also emphasize read the instructions for authors. Poor study design. Those are the mechanics of reviewing original manuscripts, and very important. Hopefully you will have done it correctly on the front end when you're developing your research and your manuscript. And the last one is what I was referring to, inappropriate interactions or communications with the journal editorial office. You just don't do that. It's not very well received. I've seen a lot of it over 20 plus years as being editor of 3 medical journals. But I would say that conflicts of interest, failure to report is not good. Probably the most important thing here is plagiarism, and we deal with that sometimes. Falsification of data, that occasionally comes up when our reviewers are very knowledgeable about the subject. We have had a few times when someone was doing the research with another individual, and they sort of took the research and ran with it and didn't include the co-investigator in the paper, and then the co-investigator calls us and we get sort of in the middle of that thing. So those can be a little dicey from time to time. You never submit the same manuscript at the same time to different journals, because we have kind of a little underground, and we find out about that, and both journals then reject it. The resubmission of previously published data, it's one thing to take some data if you've got a 2-part series, let's say, but it's another thing to pull out data of previous publication and resubmit it as a new one without indicating that same thing, because reviewers are sharp and they will pick that up. So what can we do? Sometimes I'll just send an email to an individual and say, have a concern about this or that. Really, before we proceed, would like for you to clarify that for us. And usually they do, and it's an acceptable clarification. Sometimes it's not. We then may have to do a little bit more diligence to see what maybe is happening with this. And sometimes we would reject it due to a violation, and in the rejection we will specifically point out what the problem was and how dastardly it was that they did that, Occasionally have to retract an article. Fortunately, with all the effort we do up front, that's a very unusual thing. It's a little more common in the larger journals. And you've seen that kind of make national news when things have to be retracted. On one occasion, I have actually had to contact the institution because of data that was fabricated and plagiarized. What they do with it after that is really up to the institution, but I felt like I had an obligation to let them know about this particular thing.